Welcome to Pharmtoberfest, which celebrates American Pharmacist Month. We are interviewing pharmacists who play different roles in the health of our communities. Today we have Dr. Beth Phillips, who is an ambulatory care pharmacist who cares for patients with a variety of cardiovascular conditions. Welcome, Dr. Phillips.
Thank you, Dr. Welsh. It's a pleasure to be here.
Dr. Phillips, why do you think it is important that we celebrate American Pharmacist Month?
Well, the goal of American Pharmacist Month is to recognize pharmacists' contributions to healthcare and all they do to improve the health of their communities. I think it's really important to remind the community and other healthcare professionals how pharmacists contribute to and improve patient care. We make a big difference.
Thank you. In your time practicing as a pharmacist, how have you helped your patients maintain a heart-healthy lifestyle in terms of medication and lifestyle interventions?
In my practice, I'm a provider who works with veterans to improve their health and prevent future cardiovascular events and diseases. So we add, adjust, and discontinue medications as needed to meet their drug therapy goals that are determined for us by disease state guidelines. We also work with a dietitian to encourage patients to choose heart-healthy foods and heart-healthy portion sizes. Also, at every visit, we also encourage them to engage in at least 30 to 60 minutes of physical activity on most days of the week. But specifically related to cardiovascular disease, a lot of patients are referred to us to help them gain better control of their diabetes, hypertension, or high cholesterol. And then we also evaluate all of the patient's medications to ensure that they're on the right drugs to help them prevent heart attacks, heart failure, and stroke. And then we also make sure the drugs are working for them as well as trying to prevent any side effects.
That's great. Thank you. How do you think pharmacists can impact their communities?
Well, pharmacists work in many ways to improve the health of the community, from making sure that the patient gets the right medication at the right time for the right indication, to medication adherence, which means helping them take their medications every day, remembering them, and helping them work better for them. We also do blood pressure monitoring and screening, immunizations, and so many other ways. We are here for our patients.
Thank you so much for joining us today, Dr. Phillips.
Thank you so much.
Hi everyone, my name is Tram.
And I'm Noor, and we're with APhA's Operation Heart, and we're going to talk about hypertension, which is also known as high blood pressure. Blood pressure is the measure of force with which your blood pushes against the walls of your blood vessels. Blood pressure readings are given as two numbers. As an example would be 120/80. The first number, or the upper number, 120, in the example is the systolic blood pressure, which is the pressure in your arteries as your heart contracts. And arteries are the blood vessels that carry blood away from the heart. The second number, or the lower number, is your diastolic blood pressure, the pressure in your arteries as your heart relaxes. Normal blood pressure is less than 120 for the upper number, or the systolic blood pressure, and less than 80 for the lower number, or the diastolic blood pressure. High blood pressure, or otherwise known as hypertension, is when the systolic blood pressure, or the higher number, is greater than 130, or the diastolic, or the lower number, is higher than 80.
So there are several factors that can affect your blood pressure. Unfortunately, some are uncontrollable, such as family history of hypertension, and our blood pressure also increases as we age. However, there are some controllable lifestyle choices that can contribute to high blood pressure, such as smoking, drinking too much alcohol, a diet that is high in salt, and physical inactivity. Having high blood pressure can have several consequences on your health, which could lead to stroke, vision loss, heart attack, heart failure, kidney damage, or sexual dysfunction. So there are some tips to lower your blood pressure, such as avoid smoking cigarettes or inhaling secondhand smoke, and limit alcohol consumption to less than 2 drinks per day for males and 1 drink per day for females. And maintain a healthy weight could also help with blood pressure. Limit your sodium intake to 2,300 milligrams or 1 teaspoon of salt a day. And by the way, the secret word for this video is sodium. Also aim for 30 minutes of aerobic or resistant exercise. It could be simple as running, walking, or push-up for 5 days a week can lower your blood pressure. And if you are prescribed blood pressure medications by your doctor, take as directed. So next time if you're in the pharmacy, stop by to check your blood pressure and discuss it with your pharmacist if your blood pressure runs higher than expected. And also discuss your blood pressure medications with your pharmacist if you have a problem. And thank you everyone for listening to this video.